My name is Marion, and I come from Holland.
When were you first diagnosed with cancer in your life?
That was in 2001, in end of July.
What kind of diagnosis did you get?
I had a diagnosis breast cancer later on, after the operation in the first week of August. And they found out that I had a lump of 1.7 centimeters, and it was a slow growing type. So they made an operation, and then after a while I got 35 radiotherapy and 4 chemotherapies, just to be sure. And then I started to take tamoxifen to prevent the cancer, because it was hormone sensible, to come back.
Right.
And after 2.5 years, they changed that into Arimidex.
Did they change because the first one they felt it was not working right, or just because it was lighter, the second?
The second, it was new, and it was just a new protocol.
Okay. And then the next chapter is...
Yes, that's right. I went to the clinic every year to have a checkup, and they made a mammography.
Right.
And every year it was okay. And last time, in July, they again made a mammography, and then they made an echo, and then they said, well, perhaps they found something, and they took a biopsy. It was again cancer, but they say it could have happened to anybody.
It was not expected to happen, or it was normal? It was expected.
Well, no, it was not expected to happen.
Oh, okay. So it came back again. It started
yes,
again.
but they say it is not back. They say, well, it's just a pity. It could have been in the other breast. It could have happened to anybody.
And at that point, he told you that you need to remove your breast.
Yes, that's right.
Okay. And what did you do then?
Well, I already was in contact with a person in Holland who is a friend of Dr. Simoncini, and then I flew to Rome.
Right.
Yes, that's right.
Right. Okay. So you got both infiltrations and then injections, you mean?
That's right.
Okay. And basically, so you did not get operated?
No, not yet.
You chose not to operate again?
No, not at all.
And you understood before the concept of what we was doing, right?
Yes.
The idea that he believes that actually the cancer is the fungi, that the fungus that is found in there.
Mm-hmm. Yes, of course. Yes. Okay.
And after 2 cycles of the bicarbonated and the injections, what happened?
We went back to Holland, and my breast was very, very, very swollen.
Okay, so this was the reason for the swelling. Do you know what it was?
This was the bicarbonate.
What did the doctors in the regular doctors told you at that point in?
Well, my own doctor was very positive, and was absolutely agreed with me to take the chance and to try. Mm-hmm. But of course, after a while, I was anxious to know something. So we went with a friend of us who is also a radiologist, and he made an echo, and that was 16th of October, I know, in 2006. The last injection I got here on the 9th of September.
1 month later?
Yes, we went with his friends, and he made an echography, and he could see my breast, and he said, well, there is bicarbonate and there is the lump. He could see the lump still in the bicarbonate.
Oh.
And that was the 16th of October.
No, so you have a problem now. You had to make a choice, probably. Right?
Yes, but it was 1.3 centimeters by 1, so it didn't grow. It was more or less the same. The only thing I saw on the screen was that the shape was a bit different. Then I went to in Holland to this friend, who is a friend of Dr. Simoncini, and who treated me first with the infiltration, with the bottles, And he said, well, I will contact Dr. Simoncini and just wait and don't panic.
Mm-hmm.
I didn't. We want to be sure. So we went to a hospital in Holland. It's a very well-known cancer institute in Rotterdam. And we found a doctor there who was willing to make again a mammography and an echography. That's not normal, because when you are diagnosed cancer one time, they normally don't make the second time a mammography or an echo. The radiologic our doctor asked me, when she saw the mammography, she asked me what I was doing there, because she couldn't see a thing. But then again, she was not sure, because she hasn't any experience with bicarbonate in a breast. And then she looked, oh yeah, she said, and she saw something, but it was, the shape was different, the color was different, everything was different.
And the size was different, smaller?
It was 1.5 centimeter, but not 1.5 by 1, but 1.5 by 0.07.
Okay, so again, the ecography in October showed 1.5 by 1.
More or less, yes.
Lump. Okay.
Yes.
And 1 month later, it was 1.5 by 0.7.
That's right.
And the reason, I don't understand the reason of the shock or the surprise from the second, for the last radiologist. What was the reason for her surprise when she asked you what you were doing? What was?
Well, she didn't actually ask me what are you doing here, but she was surprised because she couldn't see on the mammography. First they made a mammography, and there was nothing to be seen on the mammography.
Yeah, okay. Then in the echography she could see something. I get it now.
Yes, that's right.
So basically she has in front a diagnosed cancer patient, and she has a mammography and she does not see the cancer. This
that's
was
right.
the reason, probably. Okay, I understand. After that, the next step?
Well, after that, I got a phone call from the hospital on the 21st, and they say there is still cancer in it, because they took some cells out of this spot with the echo, which you could see.